Hi, and welcome to my final project, my creative project for our class. I'm going to be talking about my working theory and how I've developed it over the years and basically how I apply it at work. I'm going to break this up into three parts. It's more manageable like that, and it definitely it comes across a lot simpler. The first part I'm going to be focusing on the theory. Second part I'll focus on the military, and the last part I'll be focusing on combining the two and the scientific research behind it and limitations and the biblical worldview or the Christian worldview. So let's get into talking about my. There's a couple theories I like to use in terms of a crisis. Um, when you're working with crisis, time is not a factor. Obviously, I wouldn't say putting a time limit is something you can't do in a crisis. You can't say, "Hey, your hour's up. Sorry, the crisis is over." That doesn't happen. You can have a crisis last a long time. The main theories I look at in a crisis, my favorite is existential theory. I've talked a little bit about it in our class videos earlier, but I'm really passionate about existential theory. A couple of reasons. Viktor Frankl was a great theorist, and he is follows existentialism. And the book "A Man's Search for Meaning." I read his book in undergrad when I was at San Diego State, and I liked it a lot. I wasn't too familiar with anything. I hadn't decided I wanted to be a social worker yet. Um, but then when I put the dots together and also went to grad school and then read Yalom's book, A Gift of Therapy, and started connecting the dots. And these were some authors I really cared about, and I really felt I had a lot in common with their points of view. So that together, and then basically existential theory, it's more of a philosophy than it is therapeutic techniques, is being authentic and transparent with your clients. In crisis, that is probably number one. Now, um, you really have to take those values home. You have to focus on the therapeutic relationship, therapeutic alliance, awareness, helping clients find meaning. That's really my goal in terms of my therapeutic goals with my clients, helping them find a meaning, helping my clients find a will to live. I've had a lot of different crisis calls over the last 9 years, and trying to say something to convince people to not take their own lives. I've done crisis calls where they've had a weapon on them, a knife. I've had someone pull a knife on me in the middle of a session. Very scary. I've learned a lot more about checking people for weapons prior to starting a psych eval. Don't trust if someone says no, they're good to go. They don't have any weapon on them. I do want to say off my first most important part of this theory is, in terms of crisis, is your safety or the therapist's safety is number one. You can't do any therapy if you're in danger. So make sure your safety is first. That's number one. I kind of want to define crisis real quick too. In terms of crisis, I would define there can be a mental health crisis with, say, bipolar disorder, schizophrenia, substance-induced crisis, either an overdose or they're inebriated, or they're not acting sound because they're on some sort of illegal or legal drug. So that's definitely a crisis. And then there's also a natural disaster. It can be a crisis. I worked a couple of those in the fires. And then there's also the Orville Dam mission. There's a lot of different crises I've worked in that regard. An earthquake, all types of stuff. Also, I've worked a crisis overseas, a refugee crisis in Jordan. I helped out on that in 2015, 2016. And then also, definitely you can have a crisis when you're in a combat zone. Pretty much every case you're working is a crisis at that point. And then you have regular crisis like a divorce, a family member dying. Or kids getting hurt, losing a kid from an illness. I had a couple cases of those too. So these are all crises. What do you do in a crisis? So staying transparent and being authentic is rule one, and being there for your clients when you need them. It's hard to make sure you're always there for them. You just try your best. Make sure you develop a rapport. That's number one. You want to do that right away. I think Yalom has a great way of talking about it. There's this story in his text that he goes over about a group of people thriving. It's in his group therapy book. I think it's the group Psychotherapy. I talked about it earlier in class. In the book, God is taking a priest or a rabbi, I think a rabbi, to a group of people suffering. He wants to show them what true suffering looks like. And there's this room full of people, like 5 or 6 people, and there's all these. They're starving, and there's some soup in the middle of the room, and there is these long spoons, and everyone is trying to feed themselves with these long spoons. And they're all starving because it's too long. They can't make it to their face, and all this stuff's going on. So God showed the rabbi this and showed them that's true suffering. And then he showed a group of people thriving. He takes them over to a similar room, and it's the same setup, except they've learned to feed each other with the spoons. It's a lot easier to feed each other because they're so long. So really, that taught me a lot right there. That story really, I want to say, gripped me in terms of if you help out your fellow person, you help out each other. If it's a team, I feel like that. And I was also going through my reserve officer training at the time in the military, and I think those two together, I learned a lot about teamwork. And then taking hold of existential theory and taking that to work with me and working on group dynamics and being a mental health crisis worker, how do I not take that with me? And also, we learned one of Frankl's techniques, or I learned one of Frankl's techniques. We learned about it when I was at USC, and then I feel like I've got to practice it right away, is de-reflection, where you're focusing on something positive as opposed to you're kind of focused on something negative. How do you break that? I say that's working with a little like CBT, changing those cognitive distortions or getting them to refocus. That's really important. So I'd say it's a little bit of mixture of cognitive behavioral therapy, especially if you throw in some trauma narratives and you're working on some stuff. That's definitely T of CBT. But existential theory, that's what I want my clients to take away from is that trust, that therapeutic alliance and trust in being honest with them. Sometimes that can be confrontational. That can be if you're being really honest with them and confronting those, negative thoughts, or you're confronting those lies they're telling themselves. It can be really tough. And you can deal with a lot of things. You can deal with death, freedom, isolation. Isolation is a huge problem we have in the military, and existential is great for this. Especially, it helps folks develop meaning. A lot of times people join the military because they want to find meaning, or they find that the military has a certain meaning to them. Family history, they want to serve. 9/11 was a lot of reason why people join the military. And existential therapy really helped speak to me on terms of, bridging those gaps. I really like the theories. I feel like it's more of a philosophy, and that's why I'd say existential theory mixed with TF-CBT and CBT skills have really been helpful in helping my soldiers be honest with them and helping them build insights. But my two favorite theorists in the field are Yalom and Frankl. Those are probably my two favorite. Yeah, this concludes part one of my theory, and stay tuned for part two. Okay, part two. I'm going to talk more about the military's take on crisis. Okay, so I already ran through the types of crisis that exists and treatment strategies. How do we attack crisis, and how does my working theory attack crisis? That's the specific goal. We want to diffuse the crisis as quickly as possible. There's several things we do automatically. We have a couple checklists we use. I want to go over them here. One of the checklists we use in terms of academic research, it's from the Crisis Intervention Handbook, Assessment, Treatment, and Research by Albert Robert, PhD, 3rd edition. It's very helpful. They have a 7-stage checklist. I'm just going to go over them. Assess lethality. I always say a level of lethality. That's super important. And their mental status. That's 1. 2 is establish rapport and engage with the client. That's pretty obvious. Number 3, you're going to identify major problems. 4, deal with feelings. If they're sad, lonely, afraid. 5, explore alternative coping methods and potential solutions. Obviously, it is how it sounds. You look for a way to quickly solve the problem or acute problems. Develop an action plan. What are we going to do to change it? And number 7, develop a treatment and follow-up protocol. So that's pretty much the crisis intervention approach. Now, I have broken it down a little bit easier while I was in grad school. I was taking a human behavior course, and I learned a great acronym while I was in there. I think it was either from either Quizlet or Study Blue while I was in grad school, and it's Are You Safe? RUSAFE. I teach this same one to my undergrad students. It's Rule Out Medical, Under the Influence, Safety Questions, Assess, basically, determine, identify, clarify, explore. That's the A, assess. And then F is acknowledge feelings. That's the same part as the 7 stage. That's definitely in there. And then E is empower. Empower your clients. You want them to solve their own problems. There's a difference between empowering them and enabling them. We get a lot of crisis therapists that we don't want to say the wrong thing where it's just going to be another crisis in another day or so. So we want to make sure we're doing long-term crisis solutions. And then the last one we use in the military is from the Army. Is called ACE. We have a thing called an ACE card, and it was a program started by the military in the 2000s to combat our high suicide rates. We were losing upwards of, I think, 22 a day. I think that's still our veteran suicide rate. In the Army had something similar or worse. I think our worst year was in 2008. There's a lot of research behind that. But ACE was developed, and it stands for Ask, Care, Escort. So I'll kind of go over it real quick. Obviously, we want our service members to ask when someone's feeling suicidal. Now, we also train our service members to, when you feel someone's in crisis and there's the escort part, it shouldn't be you in the middle of the night trying to go de-arm them. You should call 911 and get a professional involved and make sure a MET team shows up, a mental health evaluation team. The next part is care. Show legitimate care and concern for your fellow man or woman. A lot of times we have the friends that do the one-uppers, like, oh, that's not problems, this is problems. Those aren't your friends. You want to make sure those people are not called in a crisis. The next one, escort. We do encourage our service members to escort. We don't care if it's your family member in a crisis. We want to make sure we get them to the higher level of care and get them help, or your children. And then the last part, we added it, this is custom to California, is follow up. We think it's important to also follow up with those soldiers or family members or people in crisis. A lot of times we'll do ACE, we'll have service members go through ACE, or I'll even do ACE, but you got to make sure you follow up because that's part of that relationship. I feel like that is part of being authentic. That's what I have included when I teach, anytime I teach about people using the ACE card. I want to make sure that they're authentic and transparent. But a big hurdle in the military we've had, and it needs to be talked about, and this is why it's so important to have this existential viewpoint in this therapy, is the stigma we have in the military. I wouldn't do this project justice if I didn't talk about stigma. The DOTI that discusses stigma is Department of Defense 6490.08. That is the Department of Defense instruction about how to handle stigma. And we get service members, or I should say commanders, that try to weaponize behavioral health and hurt people's career with it. I'm a big frown on that one. I try to fight that as much as I can. I have had commanders say, "Oh yeah, they've got some mental issues. They need to be kicked out." That is not how we work in the military. We treat everyone with respect and dignity. We try to get them to a higher level of care, and if we can do everything to keep the person in the military and stabilize their life. Now, the stigma is real. We get a lot of service members that are multiple time deployments, and they do not seek services, and they are suffering psychologically because they fear negative repercussions in their career. Now, we try to fight that as much as we can and try to get them to a higher level of care as quickly as possible. And being authentic and transparent with them is one of how we do that. We tell them about the DOTI. We tell them we're going to advocate for them and fight for them. Now, saying it and doing it is two different things. I was told when I started, what brought me on, there was 2 suicides and a murder suicide when I came to Central California. I came on board right after that. The tag in our state activated me right away before I'd even gone to any additional military training after I graduated grad school. And he gave me a piece of advice. He said, if you get in trouble trying to help yourself, you'll be in big trouble. Obviously, that's true with any officer. But if you get in trouble trying to help out a soldier, you're not in any trouble at all. So my main goal is just to help soldiers. And I try to be as honest as I can with them. Never try to be dishonest with my clients. But if I'm going to say something that could hurt them, that's when I'll be pretty careful with what I say. Do no harm. Definitely take that to heart. Super important to me. And what really helps me is being authentic and transparent, having that existential viewpoint. is very helpful. I would say that there's a lot of applications for this. You can do this. This is a great soldier learning tool. I could have all types of soldiers make sure they're carrying this existential philosophy. There's multiple, and I would say this is also across cultures. You could do this to all types of cultures that have existential philosophy, and it definitely can be helpful. In the next part, we're going to talk about the research, the biblical worldview or a Christian worldview, and the scientific research factors behind it. This concludes part 2. Thank you so much. Stay tuned for part 3. All right, let's talk about gaps in my theory, part 3, and some limitations of it, and biblical worldview and scientific research. Now, our class textbook actually discusses the scientific research. It talks about that it's in the sector of experimental humanistic psychotherapies. I think it's very beneficial. I think we still have a lot more research to be done on it because it's more of a philosophy. So therefore, it depends on how true the person is to the philosophy and what characteristics they adhere to. Now, in terms of limitations, now you can definitely be limited by your communication skills. If you're working with a group of people that don't speak good English and you don't either, it's definitely going to be a hindrance. And if you can't relate to them, or if it affects that ability to have trust in that therapeutic alliance, it's going to hinder you from being having a good existential theory view, or it's going to hinder you from applying those standards. Now, the one thing I can say that counters that a little bit is that, man, it is vast. There's definitely a spiritual side here that can be used with any culture. It talks about meaning. That's definitely something where you can have faith. And anytime I have a service member going through crisis and they have faith and I'm using existential theory, man, this is going to be very, very, I want to say, an easy application of existential theory, because you help them identify meaning, and the Bible is perfect for that. So yeah, introducing faith is almost like a shortcut in giving people a bigger meaning or greater good sense about themselves. So anytime you're in a crisis and they have a lack of faith, and if you can introduce that, there's definitely a lot of applications in existential therapy with the Christian worldview. It's a great philosophy to use, especially as a chaplain or as a minister. It's all about transparency, trust. That is one of the best things you can have as a minister and as a chaplain or a person of faith. So I want to say there's definitely some huge strengths there. It has many strengths. I don't want to just say it's all great. There's some struggles in terms of the humanistic side. Like, if you can't relate to the people, it's going to be hard. And then eventually, if the person never doesn't want to change or doesn't agree with what meanings you're finding out for them or what meanings you're helping them to determine, obviously, if the therapeutic alliance is never there. In the military, I'd say the biggest struggle is if the person has been command directed to see behavioral health, and they have some huge stigma issues related to it, and here I am trying to gain their trust, and they hate everything I represent. It's going to be an uphill battle, and I'm not going to be able to do much good with existential theory. So it's tough. I was able to use existential theory successfully with treating Muslims in a refugee crisis. That's one of the best things of all. If you really hold these, if you're just being transparent, truthful, and authentic, it will show through. I deal with a population that's highly trained and that has been trained to go into combat scenarios, and my job is to try to mitigate a lot of those psychological risk factors. It's a very sensitive population, and I deal with a lot of people that don't want to talk to me. So winning them over and developing rapport is my number one thing to do. I would say what needs to be done is more research. I would like to do more research on existential theory and my population in the military. Gaining trust, I'm in an aviation unit. So every time an aviator talks to me, they're worried about getting a downslip, which means they can no longer fly. So this is why this tactic and these skills have definitely helped me in saving aviators' lives and the crew members and support staff. Existential theory has been a great tool alongside TFCBT, CBT, stuff like that. Those have been great in terms of helping my population get better. Um, but there's a lot of treatment strategies to take, long-term, short-term. The VA focuses on, I hate to say this, the VA has a lot of positives, but getting in, they are overwhelmed. They do a great job for my service members. I get in there, the vet center. They use a lot of CBT, DBT, and I don't see a lot of existential theorists at the vet center of the VA. Now, there might be some of those folks that use these other theories and more philosophy, right? But I never hear it mentioned too often. I don't hear Yalom's name too much. Now, where you might hear it's more so at the vet center, where they specialize in groups, post-traumatic stress disorder, and military sexual trauma. Those where I would think you'd have to have a really strong therapeutic alliance with your clients to be successful there. So that's where I suspect where you'll see some. Now, I've never worked in those arenas, but in terms of treatment strategies, that's where I would go. In terms of crisis, this has been the best application I can think of existential therapy in crisis. Now, obviously, that's not something you'd normally hear because there's no time limit. A lot of times it doesn't focus on, it's not a traditional sense of crisis, I guess you could say. But I've been practicing existential theory, and my counterpart, my boss, Major Harris, has also been a big practicer of Yalom. That's helped my therapeutic background a lot, is know that my coworkers also practice the same type of approach in theory. It goes back to that therapeutic relationship, therapeutic alliance, trust, being transparent. But there's a big part of it too is timing. Timing is important in therapy. Obviously, that's true across the board. If as a therapist, if I can master trust, if I have trust with the people, how quickly I can gain their trust, and then use that trust appropriately, man, it's going to make saving lives so much easier. It's been a huge honor. I've loved this class. I've loved this project. Thanks for allowing me to do it over the video, and thank you so much. Hope you have a good one.